Hi, this is Dr. Kenneth Chapman, and I'm going to take you on a virtual tour of our 1360 Hylan Blvd office. Patients would enter here. Here we have a seating area. Through these doors is the ambulatory surgical center and our reception. A patient would typically come in and take one of these pads. They would check in and they would fill out whatever required information was needed as far as demographics, past medical history, past surgical history, or updates on their current status. And all this stuff is transferred to our electronic medical record. After the patient does that, they wait to be called. When it's their turn, a receptionist will take them back into the clinical area. This is the clinical aspect of the office. It's basically broken down into two pods as far as seeing patients are concerned. Each pod has 6 exam rooms and 2 bathrooms, as well as a private doctor's office on each side. And then we have additional space for back office, billing, etc. On the other side. But I'm going to take you through. Again, these both pods are essentially the same. This is the nursing station, task utility area, where not only nurses, but really providers, advanced practice providers, fellows, research students or research team will typically sit in this area. And the rooms that we'll be utilizing are going to be up here. So this is essentially one of the pods. I'm going to take my Surface computer. Each provider is provided one, which they can go and take back and forth with them to the patients. So essentially the rooms and the nursing station, they are just monitors which can be attached to the Surface. So when you see your patient and you want to show them an image on an MRI or something else from your computer screen, you simply attach it and they can have access. We also have a television that's in the room, which essentially is playing information for patients, new procedures, letting them know about practitioners in the practice, etc. But that you can take what's on your screen and move it there. So you can see up there, I have some papers that I was going through. It attaches there. Here's the unit that we have in this office. It's a GE Logic E. Typically on a day that you spend with me, you do between 5 and 10 ultrasound guided injections while at this location. And those would be typically knees, shoulders, hips, SI joint, really the bread and butter ones. Anything where there was a concern or a need to be in a monitored environment would be done in the surgical center. But I would prefer to not tie up OR time with joint injection. So we really try to get them done here. And if we go down this hallway, you know, we have two bathrooms and the 6 exam rooms. Typically after seeing a patient, after you decide what to do, it will be entered into your computer. The patient will be given a little follow-up card with what needs to be done, and it'll be taken back to the front desk. So the patient will then walk back with typically the fellow or the nurse practitioner or myself will be with them, and we will guide them to the front desk and help them make their appointment or whatever would need to be done. On this aspect of the office, we have our billing people, essentially a big billing office, as well as a kitchen. And again, when the patients leave, they would come here, head down this path to the checkout desk, and make their appointment for a follow-up or procedure as needed. Okay, thank you. There's a quick walkthrough of our office here in Staten Island. And feel free to reach out to me if you have any questions about it. We're going to come back shortly with Ambulatory Surgical Center walkthrough video. See you soon.